First I'm scanning my room. My patient, my tools, alright, I'm gonna use mirror as well. I provided privacy for my patient, sanitizing my hands. Hi, my name is Shahnoza. I'm a nurse practitioner. I'm gonna perform for you today respiratory, cardiac, abdominal, thoracic, peripheral vascular, and neurological assessment. I reviewed your vital signs obtained by the nurse, and your vital signs are your temperature is 97.2, your blood pressure is 128/82, your pulse is 84, your respiration is 40, and oxygen saturation is 98. Your height is 5'9", your weight is 190, which gives us a BMI of 28. Could you please tell me what brought you in today?
I have pain in my right wrist.
Okay, when did it start?
About a week ago.
Can you show me exactly where it hurts?
It's right here.
Okay, could you please tell me how bad is your pain in a scale from 1 to 10?
It's about 8.
Okay, what kind of pain you have?
I have a numbness and a tingling in my when I'm using my hand. My wrist. Sorry.
So it's dull shooting pain.
It's it's a sharp shooting pain when I'm moving.
Okay. Does the pain moves in different locations?
Yes, it goes towards my fingers and my forearm.
Okay. Is there anything which makes your pain worse?
When I'm writing or typing on a computer.
Is there anything which makes the pain better?
When I massage it or when I put in the heat pads, but not for long.
Did you ever experience like this pain before?
No.
Okay, it's your first time, right? Okay, I'm gonna be looking at this today, and I will start my assessment. So I'm gonna start with your chest. I'm gonna expose your chest, and I'm gonna do all my assessment over the t-shirt for my patient modesty, and I'm looking at the skin. Skin is pink, intact, warm, dry, no lesions, no I don't see any signs of trauma, bruises. So I don't see any ulcers. I don't see him using any accessory muscles, and no signs of respiratory distress. His respiration easy and regular. Patient is sitting in a normal position. I don't see anything hitting on tripod position, so no tripod position noted. And now I'm gonna ask my patient to sit with his back, and I'm gonna start with posterior chest, and I'm looking on his chest back, and I see his checking his muscular structure and skeletal structure, and I'm noting the symmetry. No signs of kyphosis or scoliosis. AP lateral diameter ratio 1:2. No evidence of accessory muscle use. Retraction of interspaces. No respiratory distress. No sign of nasal flaring. And I don't see any sign of tachypnea or any cyanosis. I'm gonna start palpating for tenderness. Any discomfort?
No.
Okay, good. Now I'm gonna do chest expansion test. Inhale deep, exhale, Good. When he's inhaling and exhaling, my hands are rising and falling symmetrically. Now I'm gonna do tactile fremetus. So every time I'm touching you, say 99.
99, 99, 99, 99.
Any tenderness?
No.
Good. So I'm feeling a slight vibration bilaterally, and it's symmetrical. And as I'm moving down, it becomes less noticeable. Now I'm gonna percuss the lung field, bilateral, and I'm hearing the resonant tone. Now I'm gonna measure the diaphragmatic excursion. In and out. Now hold. Okay, I'm feeling the change in the tone when I'm percussing in this area. Now inhale in and out. Inhale, stop. I'm hearing the change in the tone here as well. You can breathe. And the distance between two my marks is about 5 centimeters. So I'll repeat this over another side, and findings should be similar. Now I'm gonna start auscultation. I'm gonna listen for lungs. For the time purposes, my patient will be breathing faster. Every time when I'm touching you, please breathe in and in out fast. Okay? I'm starting about the scapula in. I'm hearing the lung sounds are clear throughout. And in this region on the right side, I'm hearing the right middle lobe. So I heard the bronchosecondary sounds, which medium pitched. Then I also heard the bronchial sounds, which are loud and high pitched, and vesicular sounds, soft and low pitched. All right. And his inspirations are greater than expiration. Now I'm gonna assess for egophony. So each time when I'm moving the stethoscope, please say E.
E.
Mhm.
E.
Mhm.
E.
Mhm.
E.
Mhm.
E.
Mhm.
E.
Good. It's coming through like a muffled E sound. No consolidations symmetrically. Now I'm gonna do bronchophony. You're gonna be saying 99 each time I'm touching.
99. 99. 99. 99. 99. 99.
Good. There is a muffle coming through more quietly. No consolidations. While I'm here, I'm gonna percuss for the CVA tenderness. You're gonna tell me if you have any discomfort. I'm gonna do it above the kidney. Discomfort?
No.
Good. Okay, no tenderness. Okay, good. Now I'm gonna move to the front, anterior chest. So chest is symmetrical, respirations are easy, no signs of using accessory muscles, no signs of barrel chest. I'm gonna start palpate. Any discomfort?
No.
Okay, I'm gonna do chest expansion from the front, in and out, deep. Good. So again, there is equal rise and fall when he is breathing. Symmetrical findings noted. Now you're gonna be saying 99 again, okay? Tactile
99.
parameters.
99, 99, 99.
Good. And again, when he's saying 99, it creates more vibration in the upper region and it's diminished going down. Now I'm gonna listen to the lungs. You're gonna be breathing in and out, okay? Okay, lung sounds are clear bilaterally. No wheezings, no growls. Now I'm gonna move to the cardiac assessment. So first I'm gonna assess for the hips and lifts, and I don't see any, I don't notice any. I'm gonna palpate for the base and apex of the heart and along the sternum. And I'm not finding any abnormal pulsations. Next, I'm gonna be finding the PMI, point of the maximum index. It's gonna be on the left side, under right here, under the nipple. And I feel pulsation. Next, I'm gonna auscultate with my stethoscope, with diaphragm and bell, all 5 cardiac areas. I'm starting with diaphragm. Starting right here on the right side of the sternum, second intercostal space for aortic. Moving to the left at the second intercostal space for pulmonic. Down one, third intercostal space, Earth's point. Fourth intercostal space for tricuspid. And fifth intercostal space for mitral. Now I'm gonna do same with the bell of the stethoscope. Aortic, pulmonic, tricuspid, and mitral. Now I'm gonna listen with the aortic murmur. Can you lean forward? Diaphragm and bell. Now I'm gonna listen to mitral murmur with the bell. You're gonna hold on, lean to the left. Good. I'm only hearing only S1 and S2. I'm not hearing any murmurs, gallops, ralls. I'm not hearing any S3 or S4. We're gonna put your gown back up. Now we're gonna start assessment of your abdomen. You can lay down. For the patient modesty, I'm gonna be doing assessment, and I'm just gonna cover a little bit my patient. Do you have any abdominal discomfort?
No.
Okay. First, as always, I'm gonna start with the skin. It's pink, warm, intact, dry. I don't see any bulging, no masses, no bumps. I don't see any vascular changes. I don't see any hernia or scars. His umbilicus is inverted. Okay. First, I'm gonna start with auscultation, and I'm gonna listen for the bowel movement, and I'm gonna auscultate in all 4 quadrants. Starting in the lower right quadrant, and already I'm hearing clicks and goggles. I'm hearing the bowel movement. I'm moving to other quadrants. The bowel sound is clear in all 4 quadrants. Now I'm gonna listen to the bruise of the aorta, and just here below the xiphoid process, I'm listening with the bell. I'm hearing none, so no murmurs. Moving to the right and left to listen to the renal arteries. I'm not hearing any bruise as well. While I'm here, I'm gonna palpate for the aorta, aortic span, and the aortic pulse. So I identified at the right and the left side. I'm feeling the pulse, and the distance between my fingers is about 2 centimeters, which is normal finding. Now I'm gonna start to percuss the abdomen. Okay, I'm hearing the variety of tones. I'm hearing the tympani where the air is, and I'm hearing some dullness. Next, I'm gonna start percussing for the liver span. I'm gonna start from here, from the top. Right here in the area where the sound is changes from resonant to dullness is the top of the liver. I will continue percussing. So I'm marking this area and continue percussing. Again, when I percuss down, I heard the change in the sound, and I mark the bottom of the liver, and the distance between two my marks is about 8 centimeters. So liver span is 8 centimeters. Next, I'm gonna percuss over the left costal margin for the spleen, and I'm hearing dullness. Now I'm percussing over the gastric bubble. Again, I'm hearing tympanic sounds, and over the bladder, and it's dull. Now I'm gonna start slight palpation in all 4 quadrants. So I'm checking for tenderness. Any discomfort?
No.
Okay, good. So I checked right upper quadrant, left upper quadrant, left lower quadrant, and right lower quadrant. Patient denies any discomfort. So as he said he doesn't have discomfort, I'm doing the deep palpation the same way. Any discomfort? Okay, good. So now I'm gonna palpate for the spleen. I'm gonna move from the umbilicus towards the left costal margin. Okay, I'm not feeling any enlargement of the spleen. Next, I'm gonna palpate the liver with the hook method. So I'm gonna push down deep, and you just inhale deep. Okay? Breathe. Good. I'm not feeling any enlarged liver, so no hepatomegaly. No. Next, I'm gonna palpate for inguinal lymph nodes, horizontally, vertically. Okay. I am not finding and I'm not feeling any enlarged lymph nodes. Next, I'm gonna do rebound tenderness. This is to check for appendicitis. Any discomfort?
No.
Okay, negative rebound tenderness. The next, I'm gonna do saw sign test. You're gonna push up against my hand. Any discomfort?
No.
Okay, good. Negative saw sign. The next, I'm gonna do obturation test. Okay. Bend your knee. Rotate. Any discomfort?
No.
Okay. Negative obturation sign. Next, I'm gonna start peripheral vascular assessment. Please sit. I'm gonna start assessing pulses. Radial pulse, +2 and strong. Brachial pulse, +2 and strong. Popliteal pulse, +2 bilateral. Pedal pulse, +2 bilateral. Posterior tibial, +2 bilateral. And dorsalis pedis pulse, +2 bilateral. Next, we're gonna do the Allen's test. So I'm gonna check for the blood flow coming. So I'm gonna press to radial and ulnar artery and make a fist. So open, I'm releasing the radial artery and I'm checking. Good, the blood comes back fast. Okay, fist, open, releasing ulnar. Good, and I can see that the blood comes back fast, the color returns pink. So the blood flow is good. The next, I'll do this in both hands. So in this position, just lay down again. I'll perform the Berger's test. Please lift your leg up. Just roll your ankles a few times. Give me your hand. And we sit right away. Okay. I'm looking for the color change, which is supposed to come back within 10 seconds. And I observed that it did it. So there is no vascular insufficiency. I'll do it in both legs. Now, right here, when I'm looking on his lower extremities, I'm not seeing any varicose veins, no edema, palpation, bilateral. Do you have any discomfort? Okay, good. Next, I'm gonna do right here the Homan sign. Lift, extend your leg, pull your toe towards your nose. Okay, good. Any discomfort in your calf? Good. Okay. Negative Homan sign. This is we're doing to check DVT. Now we're gonna assess your upper extremities. Please see the back in here. Sit. Okay, let me see your hands. I'm palpating hands. I don't see any redness, swelling, or deformities. No nodules. First, I'm gonna look on his hands. Skin is pink, dry, no bumps, nodules. Hands are dry and warm. I don't see any signs of lymphedema. Do you have any pain when I'm touching your fingers? Okay, I palpated finger joints and he said there is no discomfort. Let's do some range of motions with your fingers, okay? You're gonna open, close, flex, extend, abduct, adduct, let's do some samba position, good job, good range of motion, movement, all digits is good. Next, close your eye, put your hand down. Tell me where your finger goes.
Up, down.
Good sense. Now grip my hand and squeeze. Good. Good muscle strength, and it's 5. Now I'm gonna check your wrist, okay? So again, skin is intact, no redness, swelling, no deformities, no nodules. We're gonna do some range of motions on your wrist. Okay, can you flex, extend, in, out, and rotate. Range of motion all clear. Now you're gonna squeeze my finger again. Go. Push against my hand, up, down. Good. Good strength, +5. Next, I'll do it usually in both sides. So as I suspecting that my patient has a carpal tunnel, I'm gonna do a few tests for that. Let's start with a Fallon test. Bring your hand like this, push against. Usually we're doing it within 60 seconds. Any discomfort?
Yes.
Where?
My right wrist.
Okay, as I suspected that he has a carpal tunnel, he says he has discomfort on his right wrist. Right here I'm gonna do denial test. Again, I'm gonna tap on the medial nerve and he's gonna tell me if he feels any discomfort. Any discomfort?
Yes.
Okay, positive denial test. So we have 2 positive tests for carpal tunnel as I suspected. Okay, Next, this test would be performed bilateral. Now I'm gonna move to elbow. Again, skin is warm, intact. Any discomfort?
No.
Okay, no bruises, edema, and no swelling. Okay, we're gonna do some range of motion. Okay, flex, extend. Good. I'm gonna apply pressure. You can use only one hand. Up, down. Good. Good range of motion and muscle straight is 5. Next, I'm gonna move to his shoulder. Again, shoulders are symmetrical, no redness. Any discomfort?
No.
Okay. Skin is warm and pink. There is no redness, no swelling, no deformities, and good. We're gonna do some range of motion, okay? So you're gonna flex, extend, hyperextend, abduct, abduct. Good. Any pain?
No.
Good. So no pain. We're gonna check the strength. Straight up your hand. Push. Hold on. Now you can push forward like this. Good. Push back. Out. Out. And in. Good. So we have +5 strength. Now we're gonna check your deep tender reflexes. I'm gonna use my hammer. Let me do this way. I'm gonna check the muscle constriction. I'm using radial brachial. Good, I see muscle constriction. Next, we are going for biceps. Good, we're going for triceps. Good. So in here, all the reflexes are +2. Now I'm gonna go to patella. Relax your feet. Good. +2. Achilles. Good. +2. Checking for Babinski sign. Good. No flaring of the toes, and the big toe didn't point upward, so negative Babinski sign. Now I'm gonna ask you to lay down again. I'm gonna assess your lower extremities. We're beginning with the toes. Toes are symmetrical, skin is intact, no redness, swelling or deformity, no nodules, no crepitus. Can you flex your toes, extend, hyperextend, good, abduct, adduct, good, good range of motion. Close your eyes and tell me where I'm moving your greater toe.
Up, down.
Good, good. He has good position sense. Next, I'm moving to his ankles. Again, ankle, the skin is warm, dry, intact, no edema, no redness, no deformities. We're gonna do some range of motion in here again. Okay, so do you have any discomfort? Okay, good. Let's point down your down. Up. Good. Rotate. Move your ankle inward. Good. Outward. Good. Plantar deviation is good. Next, let's assess the strength. Push up. Down. Good. Strength is +5. Now I'm moving to the knee. I will do is the same on other ankle as well. So looking at the knee, I see again there is no edema, knees are symmetrical, no bruises, no crepitus. Any discomfort? Okay, no deformities. Let's do some range of motion. Lay down. Okay. Flex. Good. Extend. Good. Push against my hand up, down. Good range of motion and good strength, +5. Now I'm gonna move to the hip. I'm doing assessment over the shorts. Any discomfort?
No.
Okay. No redness, swelling, no any deformities, no tenderness. Let's do some range of motion. Okay. Raise your leg up, down, abduct, abduct. Good. Did you have any discomfort? Good. Push against my hand, up, down. Good. Now out, in. Good. Perfect. I'll check it bilaterally, and muscular strength is 5. Now you're gonna stand, and I'm gonna check your spine. Alright, any pain or discomfort?
No.
The spine is midline, and no lordosis, no kyphosis, no scoliosis. Now lean forward. Again, no curving, no signs of scoliosis. Good range of motion when he's bending. Okay, now let's do some range of motion. Right lateral flexion, left lateral flexion, rotate. Good. Any pain or discomfort?
No.
Okay, good. Good range of motion. Next, let's do some sensory assessment. Have a seat right here. I'm gonna use sharp and dull objects, and you're gonna tell me, close your eyes and tell me where you feel it.
Left hand. Soft on my right leg. Sharpen my left leg. Soft on my right leg.
Good sensation in all on major dermatomes. Next, I'm gonna do. He was able to identify. Now I'm gonna use my vibration. Close your eye and tell me what you feel.
Vibration. 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 Vibration.
Good.
Vibration.
Good.
Vibration. Vibration.
Good. I'll do it bilaterally. He has a good sensation peripherally. Next, I'm gonna perform the graphesthesia test. Close your eyes, and you're gonna tell me what I'm writing on your hand. Okay? Give me a hand.
8 sign.
Good. Graphesthesia is intact. The next, keep your eyes closed. We're gonna do stereognosis. I'm gonna put an object in your hand, and you're gonna tell me what is that.
Key.
Good. He was able to identify, so stereognosis is intact. The next, we're gonna check for your cerebral coordination. You can open your eyes, stand up. You're gonna move your index finger to nose and in out faster. Good. Flip flop with your hand. Okay, good. Now bring your heel down the shield like this. Okay, good. He has good cerebellum functioning. Oh, let's do again. Finger position. Good. Okay, cerebellum. Good cerebellum coordination. The next, we're just gonna check your gait. Okay, just do few steps over there. Okay. Now walk heel to toe. Stop. Just walk in tiptoes. Stop. Walk on your heels. Good. Good gait. Gait is steady. The next, now we're gonna do a Romberg's test. Close your eyes. Bring your feet together. Hands to the side, and stand. Stay like this. Good. Patient has a good balance. Next, you can sit. We're just gonna do some mental health assessment, okay? So could you please tell me your date of birth?
June 11, 1988.
Where you are now?
In your apartment.
Who is a U.S. president?
Donald J. Trump.
Okay. Patient is oriented to the place, time, and person. I'm gonna tell you 3 words. You have to remember them, and later I'm gonna ask you these words. It's
Okay.
gonna be apple, penny, table.
Mhm.
Tell me.
Apple, penny, table.
Good. Okay. Now I check your judgment. If you would find an envelope which is stamped and addressed on the ground, what would you do?
I'll take it to post office.
Good. The judgment is intact. Now we're gonna do a series of 3 tests. Okay. I'm gonna tell you a number, and you're gonna subtract 3 backward. 100.
97, 94, 91.
Good. Very good cognitive function. So cognitive function is intact. Now tell me those 3 words I told you before.
Apple, penny, table.
Good. The recent memory is intact. At this point, our assessment concludes. Thank you.